Hey everyone, welcome to the chapter on gastroenterology. This is a fascinating topic. After all, the GI system is responsible for everything from digestion to nutrient absorption. If you're interested in a fun, non-technical take on the digestive system, I recommend Gulp, Adventures on the Alimentary Canal, by Mary Roach. It's an easy, entertaining read with a fresh perspective on how our bodies process food. But for now, let's get into the technical side. We're starting, as always, with word parts, and in this chapter, most of them will be combining forms, with just a few suffixes at the end. Let's dive in. Alright, let's break down some key word parts in gastroenterology. These are the building blocks of medical terms you'll see throughout this chapter. First up, aliment/o, this means food or nourishment. Fun fact, the term alimentary canal literally means the pathway for food through the body. Next, anastom/o, this means to create an opening between two structures. You'll see this in surgeries like bowel resection when doctors reconnect sections of the intestine. Then we have bili/o and chole/e, both refer to bile, the digestive fluid produced by the liver. We'll cover bile's function more in the next lecture. Keli/o means abdomen. If you've heard of celiac disease, that term just means pertaining to the abdomen, a connection to its effects on digestion. And lastly, she/o means to pass stool or feces. You'll see this in terms like hematochezia, which refers to the passage of blood in stool. That's a quick rundown of some important combining forms. Let's keep going. Let's keep going with more key word parts in gastroenterology. First, cholangy/o, let's break this down. You might remember angio from the cardiovascular system, where it meant vessel. Here, it refers to a bile vessel, specifically, the bile ducts that transport bile from the liver to the intestines. Next, cholecyst/o, this one comes from chole, bile, and cyst, bladder or reservoir, so it refers to the gallbladder, which stores bile produced by the liver. Moving on, deglutition/o, this means swallowing, and you'll see it in terms like deglutition, which is simply the act of swallowing, a key step in digestion. You probably already know gastro/o, this one means stomach and shows up in words like gastritis, inflammation of the stomach, or gastroscopy, examining the stomach with a scope. And finally, gloss/o, this refers to the tongue. You'll see it in terms like glossitis, inflammation of the tongue. These word parts make up the foundation of many medical terms in GI, so keep them in mind as we move forward. Alright, let's wrap up this set of gastroenterology word parts. First up, gustat/o, this means taste, an essential part of digestion that starts the moment food hits your tongue. Next, hepat/o, this one means liver. You've probably already seen it in words like hepatitis, inflammation of the liver. Then we have lact/o, which means milk, you'll see it in terms like lactose, the sugar found in milk. Now, lapar/o, another term for abdomen. We've already seen keli/o, which also means abdomen, but lapar/o is often used in procedures like laparoscopy, a minimally invasive abdominal surgery. Then there's lingue/o, meaning tongue. If you speak Spanish, this one might be familiar. It shows up in terms like sublingual, which means under the tongue, as in sublingual medications. And finally, lith/o, this means stone. In this chapter, we'll talk about gallstones, and in the next chapter on nephrology, we'll cover kidney stones. That's a wrap on this set of word parts. Let's keep going. Alright, let's go through our final set of gastroenterology word parts. First up, mastic/o, this refers to chewing, as in mastication, the process of breaking down food in the mouth. Next, or/o, this one means mouth or oral, so you'll see it in words related to the mouth, like oropharynx, the part of the throat behind the mouth. Then we have orex/o, meaning appetite. You might recognize it from anorexia, wherein means without, so it literally translates to without appetite. Pep/o means digestion, and it shows up in words like dyspepsia, which means difficult or painful digestion, basically, indigestion. And finally, phag/o, this means to eat. We touched on this in the endocrine chapter when we talked about polyphagia, which means excessive eating. That's it for our GI word parts. Now let's put them into action. Let's go through a few more key gastroenterology word parts. First, sial/o, this one refers to saliva or salivary glands, which play a big role in breaking down food before it even reaches the stomach. Next, splen/o, this means spleen. You probably guessed that one. The spleen helps with immune function and filtering blood. Then we have stall/o, which means contraction. You'll see it in peristalsis, the rhythmic muscle movements that push food through the digestive tract. Steat/o means fat. This pops up in terms like steatorrhea, which refers to excess fat in the stool, often a sign of digestive issues. And finally, stomat/o, which means mouth. You'll see it in words like stomatitis, inflammation of the mouth. That's it for today's word parts. Let's move on. Alright, you're almost there, just a few more suffixes to go. First up, ASE, this means enzyme. You'll see it when we talk about digestion, like lactase, the enzyme that breaks down milk sugars. Next, emesis, this refers to vomiting or the vomited contents. You might remember hematemesis, which means vomiting blood. Whether it means the action or the result depends on the context. Then we have entery, which means a condition of the intestines. A common example is dysentery, a severe infection of the intestines. And finally, rhea, meaning discharge or flow. You already know this from diarrhea, which means excessive discharge from the intestines. It's also used in other systems, like rhinorrhea for a runny nose. That's it for GI word parts. Great job making it through. Now, let's put these into practice. Alright, you know the chapter isn't complete until we cover abbreviations, so let's go through some key ones for gastroenterology. First up, AC, this comes from Latin, ante cibum, meaning before meals. You'll see this on prescriptions to indicate when to take medication. Next, BM, which stands for bowel movement, pretty straightforward. Then we have BRBPR, which stands for bright red blood per rectum, a term used for rectal bleeding. GERD is a common one, gastroesophageal reflux disease, aka chronic acid reflux. If you or someone you know experiences frequent heartburn, this might sound familiar. LFT stands for liver function tests, which help evaluate liver health, important since the liver plays a major role in digestion. NG means nasogastric, referring to the nasogastric tube that runs from the nose down to the stomach for feeding or drainage. NPO comes from the Latin nil per os, meaning nothing by mouth, used before surgery or certain procedures when patients shouldn't eat or drink. PC is the opposite of AC, it means after meals, from the Latin post cibum. You'll see this for medications that need to be taken with food. And finally, PEG stands for percutaneous endoscopic gastrostomy, or simply, a feeding tube placed directly into the stomach for long-term nutrition. That's a wrap on abbreviations. Great job making it through. Now, let's put all this knowledge to use. And that's a wrap on Chapter 3, Gastroenterology. You made it through the GI terms, procedures, and abbreviations. Great job. Now, do yourself a favor, get up, stretch, grab some water, and take a quick break. When you're ready, come back, and we'll dive into the next topic, anatomy.
Hello. My name is Bertha. I'll be continuing with anatomy. Alright, here we are. Lecture 2, Anatomy. In this session, we're diving into the structure of the entire GI tract and the physiology of digestion. The goal of this system? To extract nutrients from whatever you eat. Whether it's a healthy meal or junk food, your body's job is to break it down and absorb what it can. We'll cover how food moves through the system, the key organs involved, and the processes that turn food into fuel. Let's get started. Let's start our GI anatomy discussion with the oral cavity, where digestion begins. First, we have the salivary glands, 3 sets located near the ears, under the jaw, and under the tongue. Ever eaten something super sour? That rush of saliva you feel comes from your submandibular glands kicking in. Saliva is amazing. It lubricates food, reduces friction, and helps with digestion. Believe it or not, you produce about 1 liter of saliva per day. Next up, teeth. These are essential for breaking down food mechanically. Good dental health equals good nutritional health because chewing properly is the first step in digestion. Then we have the palate, which separates the mouth from the nasal cavity. If you touch the roof of your mouth, you can feel the hard palate in the front. Towards the back, there's the soft palate, which helps with swallowing. Finally, the mucosa. This delicate lining covers the oral cavity and the entire GI tract. If you've ever eaten something spicy or acidic and felt irritation, that's your mucosa reacting. Later, we'll discuss conditions like ulcers, which affect this lining. That's a quick intro to the structures at the start of digestion. Let's move deeper into the GI tract. Now, let's move deeper into the upper GI tract, where food moves from the mouth to the stomach. First, we have the pharynx, a shared passageway for both air and food. We talked about this in the pulmonary system, but here, it plays a role in swallowing. Next up, the epiglottis, a small flap of tissue that ensures food goes down the esophagus instead of the windpipe. If food ever goes down the wrong pipe, that's your epiglottis not fully closing in time. It happens to everyone. Then, we reach the esophagus, the muscular tube that transports food to the stomach. At the bottom of the esophagus, we have an important structure, the lower esophageal sphincter, LES. The LES is like a one-way valve. It prevents stomach contents from coming back up. This is why, as a kid, you could eat lunch and immediately hang upside down on the monkey bars without food coming back up. Fun fact, older anatomy books sometimes call this the cardiac sphincter, but it has nothing to do with the heart. Finally, at the other end of the stomach, we have the pyloric sphincter. This controls when partially digested food moves from the stomach into the small intestine. Together, the LES and pyloric sphincter keep food in the stomach long enough for digestion to happen properly. That's the upper GI tract. Next, we'll talk about what happens after food leaves the stomach. Now, let's talk about the small intestine, where the real work of digestion happens. First, a quick clarification. When we say small intestine, we're talking about diameter, not length. In reality, it's about 20 feet long, all packed into your abdomen. That's pretty incredible. The main job of the small intestine? Absorption. The stomach acts as a staging area, but the small intestine is where nutrients actually get absorbed into the body. It has 3 sections. Duodenum, the first section, where most digestion occurs. Jejunum, the middle section, where nutrient absorption kicks into high gear. Ileum, the final section, leading into the large intestine. Understanding these names matters. If you hear a term like jejunostomy, you'll know it refers to a surgically created opening in the jejunum, part of the small intestine. That's the small intestine in a nutshell. Now let's move on to what happens next. Now that nutrients have been absorbed in the small intestine, we move on to the large intestine, the body's waste processing center. Unlike the small intestine, the large intestine is only 5 feet long, but has a much wider diameter. Its main job? Create solid waste. The body removes water from what's left, forming feces before elimination. The large intestine is divided into 4 sections. Ascending colon moves waste up the right side of the body. Transverse colon moves waste across the abdomen. Descending colon brings waste down the left side. Sigmoid colon, the final section that connects to the rectum. And that's the GI journey, from teeth to rectum. Next, we'll talk about what happens when things go wrong in the system. Beyond the GI tract itself, we have 3 key accessory organs that play a huge role in digestion. Liver. This powerhouse organ produces bile, which helps break down fats. Gallbladder. It stores and releases bile when needed for digestion. Pancreas. We talked about it in endocrinology for insulin and glucagon, but here, it plays another role, releasing digestive enzymes that help break down food. These organs don't handle food directly, but they support digestion by producing and storing essential substances that make nutrient absorption possible. Up next, let's talk about how these processes actually work. Alright, let's break down what really happens when you eat. I'm craving M&Ms, so let's use that as an example. First, the moment I pop an M&M into my mouth, my saliva jumps into action. It contains salivary amylase, an enzyme. Remember, ASE means enzyme, that starts breaking down carbohydrates right away. So even before I swallow, chemical digestion is already happening. As I chew, I'm forming a bolus. That's the name for food once it's been chewed and mixed with saliva. The word bolus comes from Latin and means a small ball, which makes sense because it's shaped that way as it moves through the digestive tract. Next, deglutition, aka swallowing, kicks in. My tongue pushes the bolus toward the back of my mouth, triggering an automatic swallow reflex. Ever accidentally swallowed gum and wondered why? That's deglutition at work. Once food, or gum, reaches that point, your body takes over. Now, the bolus moves down the esophagus thanks to peristalsis, a series of rhythmic muscle contractions that push food forward. This is why you could, if you really wanted to, eat a sandwich upside down on the monkey bars. Gravity isn't required for food to reach your stomach. That's how food moves through the first part of digestion. Now, let's see what happens next. Now that the food bolus has made it to the stomach, let's talk about what happens next. The stomach's main job is to churn the bolus, mixing it with gastric juices to start breaking it down. Two key enzymes are at work here. Renin helps digest milk proteins, especially important for infants. Pepsin breaks down proteins into smaller components for later absorption. Once the bolus is fully mixed with gastric juices, it transforms into a thick liquid called chyme. So, the moment food enters the stomach, it's still a bolus, but once it's broken down enough to move forward, we call it chyme. Important note, no chemical absorption happens in the stomach, it's just a prep and staging area. The real absorption begins when chyme moves into the small intestine. Up next, let's see how nutrient absorption actually happens. Now that chyme has been fully processed in the stomach, it's time for nutrient absorption, and this happens in the small intestine, the real star of digestion. First, the pyloric sphincter opens, releasing chyme into the small intestine. But it's not fully broken down yet, so we need more enzymes to finish the job. Bile, produced by the liver and stored in the gallbladder, is released to break down fats. The pancreas helps out by releasing pancreatic lipase, which also breaks down fats. It also produces pancreatic amylase, continuing the breakdown of carbohydrates that started in the mouth. Meanwhile, the intestinal villi, tiny folds in the small intestine, release sucrose, maltase, and lactase to help digest sugars. With all these enzymes at work, nutrients are finally broken down into their simplest forms and absorbed into the bloodstream. This is why the small intestine is the MVP of digestion. This is where your body actually gets the nutrients it needs. Up next, let's see what happens to everything that's left over. Great job! That's a wrap on Lecture 2, Anatomy and Physiology. You've made it through the entire digestive process, from the first bite to nutrient absorption. Now, we're moving on to Lecture 3, Health and Wellness, where we'll explore how to keep the GI system functioning at its best and what happens when things go wrong. As always, if you have questions, feel free to ask. For now, take a break, stretch your legs, grab a snack, or watch some TV for a bit. Then come back refreshed and ready for health and wellness.
Hey everyone, my name is Chad. Welcome to Lecture 3, Health and Wellness. Today, we're shifting our focus to keeping the GI system healthy and what happens when it's not functioning properly. Let's be real, we've all experienced some kind of digestive issue at some point, whether it's indigestion, bloating, or worse. Some of what we cover will feel very familiar, and some might be new to you. So, let's dive into how to keep your digestive system running smoothly and what to watch out for when it doesn't.
Let's jump right into upper GI system disorders, starting with some common conditions that can affect eating and digestion. First up, anorexia. This simply means loss of appetite. It can happen for many reasons like illness, stress, or certain medical conditions. Next, dysphagia, difficulty swallowing. This can be due to anything from a sore throat to nerve damage after a stroke. If swallowing becomes painful or difficult, it can seriously impact nutrition. Then we have polyphagia, which we mentioned back in the diabetes lecture. It means excessive hunger or overeating. It's often linked to conditions like diabetes or metabolic disorders. And finally, sialolithiasis. It may sound pretty, but it's not a pleasant condition. Sial/O equals salivary, lith/O equals stone, and yashas equals a condition. So this means a stone in the salivary gland, which can block saliva flow and cause pain and swelling. Those are some key upper GI disorders. Let's move further down the digestive system and see what can go wrong there. Let's continue with some more upper GI disorders, starting with a common one. First, stomatitis. This is simply inflammation of the mouth. You've probably had this at some point, maybe from braces, spicy or acidic foods, or even too many Sour Patch Kids or salt and vinegar chips. Can also lead to glossitis, which is inflammation of the tongue. Next, dyspepsia, where pep/O means digestion. This is just the medical term for indigestion, painful or difficult digestion. People with dyspepsia often take antacids to relieve discomfort. Then we have GERD, gastroesophageal reflux disease. This happens when stomach acid flows backward into the esophagus, causing heartburn and irritation. Normally, the lower esophageal sphincter, LES, keeps stomach contents down, but in GERD, it's not tight enough. Common fixes: eating smaller meals, avoiding late-night eating, and elevating the head of the bed. Hematemesis means vomiting blood, which usually signals an ulcer or erosion in the GI lining. If the blood sits in the stomach for a while, it can look like coffee grounds when vomited. This means the blood has started digesting before being expelled. And finally, peptic ulcer disease, PUD. This is when the stomach's protective mucosal lining breaks down, causing painful ulcers. A common cause? The H. pylori bacterium, which leads to chronic irritation. That's it for the upper GI. Now let's move down to the lower GI tract and talk about intestinal disorders. Now let's move on to lower GI disorders, where we'll cover conditions that affect the intestines and rectum. First up, ileus. This is when peristalsis stops, meaning food and gas can't move through the intestines. One of the most common causes: general anesthesia. After surgery, doctors and nurses will ask, "Have you passed gas?" Because that's a sign that peristalsis is returning. It may sound odd, but it's an important recovery milestone. Next, appendicitis, an infection of the appendix. Sometimes, food particles or waste get trapped in the appendix, causing inflammation and pain. In the US, Canada, and Mexico, the usual treatment is an appendectomy, surgical removal of the appendix, but in some parts of Europe, antibiotics are used instead. Either way, it must be treated to avoid serious complications. Then we have diverticulum. These are tiny pouches that form in the intestinal wall, often as we age. They're usually harmless, but if food, especially something like corn nuts, gets lodged in one, it can cause irritation, bleeding, or infection, leading to diverticulitis. Once treated, the person is said to have diverticulosis, meaning they now have diverticular disease. And finally, hemorrhoids. These are swollen veins in the rectum, often caused by straining during bowel movements, pregnancy, or prolonged pressure. Hemorrhoids can cause pain, itching, and even bleeding, sometimes showing up as bright red blood per rectum, BRBPR. Thankfully, they can often be managed with over-the-counter treatments like creams or ointments. That wraps up lower GI disorders. Now, let's look at how to keep the digestive system healthy. Let's continue with a few more lower GI disorders, focusing on symptoms that often signal serious underlying conditions. First up, hematochezia. This means passing bloody stool. Hemat/O equals blood. Chezia equals to pass feces. It's pretty obvious that blood in your stool is not normal. And if this happens, it's definitely a reason to see a doctor. Next, melena. This refers to dark, tarry stools, which usually means bleeding higher up in the GI tract. By the time the blood reaches the stool, it has coagulated, giving it that black, sticky appearance. Then we have steatorrhea, which means fatty stool. Steat/O equals fat. Rhea equals flow/discharge. This happens when undigested fats end up in the stool, often due to pancreatic enzyme deficiencies. Remember, the pancreas releases lipase, which breaks down fats. People with pancreatic disease or conditions like cystic fibrosis can experience steatorrhea due to missing or insufficient enzymes. And finally, hernia. This occurs when a weakness in the abdominal wall or diaphragm allows intestines to bulge out. There are different types of hernias, categorized by location and severity, but they all result from a muscle weakness that allows tissue to protrude where it shouldn't. These symptoms can indicate serious digestive issues, so recognizing them is important. Up next, let's talk about how to maintain a healthy GI system. Now let's go over other GI system disorders, focusing on conditions that affect the liver and pancreas. First up, ascites. This is an accumulation of fluid in the abdominal cavity. It happens when the body produces excess peritoneal fluid, often due to liver disease or certain cancers. People with ascites may develop a distended belly from all the fluid buildup. Treatment usually involves treating the underlying condition or draining the fluid with a paracentesis, which we'll cover in the next lecture. Next, cirrhosis. This is irreversible liver damage caused by long-term scarring. The liver is incredibly resilient, but chronic damage, like years of alcohol use or hepatitis, can lead to scarring that prevents it from functioning properly. Unlike temporary liver stress, like taking too much Tylenol once, cirrhosis means the damage is permanent. Then hepatitis, which is inflammation of the liver. It's commonly viral but can also be caused by toxins, alcohol, or drug overdoses like too much Tylenol. Depending on the type, hepatitis can be short-term or chronic, leading to long-term liver damage. And finally, pancreatitis. This is inflammation of the pancreas, and let me tell you, it's miserable for those who experience it. Symptoms include severe nausea, vomiting, and intense pain. It can be caused by chronic alcohol use or a blocked bile duct from a gallstone, preventing digestive enzymes from leaving the pancreas. These conditions can be serious and life-threatening, so early diagnosis and lifestyle changes can make a huge difference. Up next, let's wrap up this lecture and talk about ways to keep your GI system healthy. Now, let's talk about gallbladder disorders, especially those related to gallstones and bile flow. First up, cholangitis. This is inflammation or infection of the bile ducts. Cholangi/O equals bile duct. Itis equals inflammation. This happens when the common bile duct becomes blocked, often by gallstones or infection, leading to serious complications. Next, cholecystitis. This is inflammation of the gallbladder itself. Cholecyst's/O equals gallbladder. Itis equals inflammation. The gallbladder stores bile after the liver produces it, and when it gets inflamed, it causes severe pain, nausea, and vomiting. If you or someone you know has had gallbladder problems, you've probably heard how intensely painful this can be. And finally, cholelithiasis. This is the formation of gallstones in the gallbladder. Chol equals bile. Lith/O equals stone. Yashas equals condition. These stones can range from tiny grains to large, pebble-sized stones. If they block bile flow, they can trigger cholecystitis or cholangitis, leading to severe symptoms. Gallbladder issues are incredibly painful, and in many cases, the best treatment is gallbladder removal, something we'll discuss more in procedures. Next, let's look at ways to prevent these digestive issues and keep your GI system healthy. Great job! You just powered through a lot of information. We covered GI disorders, symptoms, and complications, but of course, there's even more in your chapter if you want to dive deeper. Next up, we have our final lecture, GI procedures, where we'll go over the tests, treatments, and surgeries used to diagnose and manage digestive disorders. For now, take a break, stretch your legs, grab a snack, and come back refreshed. I'll talk to you soon.
Welcome back to Medical Mysteries Unlocked. So far, we've covered diagnostic tests. Now, let's talk procedures. These are the hands-on techniques doctors use to diagnose, treat, or prevent medical conditions. From scopes and biopsies to surgeries, procedures help uncover issues and, in many cases, fix them. In this episode, I'll break down some key procedures, what they involve, and why they matter. Let's get started. GI procedures, the tests and treatments that keep digestion on track. Studio microphone. Welcome back to Medical Mysteries Unlocked. Today's focus is on gastrointestinal procedures, the diagnostic tests and surgical treatments used to manage digestive disorders. Starting with paracentesis, a procedure that removes excess fluid from the abdomen, often necessary for patients with liver disease or infections. Next, bowel resection with anastomosis, a surgery where a diseased section of the intestine is removed and the remaining ends are reconnected. This is used for cancer, obstructions, or inflammatory diseases. In cases where reconnection isn't possible, a colostomy may be performed. Here, part of the colon is redirected to an abdominal opening, allowing waste to exit into a colostomy bag. For hernia repair, there's herniorrhaphy, a procedure that reinforces weakened abdominal muscles to prevent organs from pushing through. Weight loss surgeries like gastroplasty reduce stomach size to help patients struggling with severe obesity. For gallbladder issues, cholecystectomy is the surgical removal of the gallbladder, typically due to gallstones or chronic inflammation. In emergencies, appendectomy is performed to remove an inflamed appendix before it ruptures. Finally, gastrectomy involves the partial or total removal of the stomach, often necessary for stomach cancer or severe ulcers. These procedures play a life-saving role in treating serious conditions. Stay tuned as we wrap up with GI health tips and prevention strategies. Welcome back to Medical Mysteries Unlocked. Today, we're covering key gastrointestinal procedures, the ones doctors use to drain fluids, remove organs, or repair the digestive system. Let's start with paracentesis, a procedure that removes excess fluid from the abdomen, often done for patients with liver disease or infections. Next, bowel resection with anastomosis. This is when a diseased section of the intestine is removed and the healthy ends are reconnected. It's used for cancer, blockages, or severe infections. Sometimes a connection can't be made, leading to a colostomy, where part of the colon is redirected to an opening in the abdomen for waste to exit into a colostomy bag. Then there's herniorrhaphy, a surgical repair of a hernia, where weakened abdominal muscles allow organs to push through. Moving up the digestive tract, gastroplasty is a weight loss surgery that reduces stomach size to help treat severe obesity. Cholecystectomy is the removal of the gallbladder, typically due to gallstones or inflammation. Then we have appendectomy, a common emergency surgery to remove an inflamed appendix before it ruptures. And finally, gastrectomy, the partial or total removal of the stomach, usually done for stomach cancer or severe ulcers. Each of these procedures plays a crucial role in treating serious conditions. Stay tuned as we continue exploring more life-saving interventions. That wraps up our deep dive into diagnostic tests and procedures, the tools and techniques that help doctors detect, treat, and even prevent serious health conditions. From lab tests to surgeries, each step plays a critical role in patient care. The key takeaway? Early detection and timely intervention save lives. Whether it's a simple blood test or a major surgery, understanding these procedures can help you feel more informed and prepared. Thanks for tuning into Medical Mysteries Unlocked. If you enjoyed the series, don't forget to subscribe, share, and send us your questions. Until next time, stay curious and stay healthy.